if I've got this right, that there are some things that we can do to help ourselves, and that is to breastfeed if we're at that age and having children. We can reduce our alcohol consumption. We can reduce our sugary drinks. We can increase our nutritional intake of foods and decrease our body weight and exercise. And some of these things can help us live better and healthy and long lives. So as you were speaking, there are some questions that came through. Lean on me at 403@gmail.com. Lean on me at 403@gmail.com. And one of the questions I'm trying to understand here is that I think you mentioned, Nurse Nora, that 15 to 20% of the population will end up with this triple negative breast cancer. So the question is, because you said that there are disparities in the African American and Hispanic communities, and Delaware has a high number of cases in the nation. The question is asking, is there something contributing to this high number of breast cancer in Delaware that's environmental, that has an environmental association?
Yeah. And I'm going to just clarify that we always get that question, and the way that I answered is, we don't know. But we do know, what we do know is, and Dr. Sims-Mortada is our chair of our breast research group, and she's done a lot in the lab and looking at the different pathways to figure out what might be an association with breast cancer. And so we don't know that. I mean, there has been a lot of conversation about, is it Delaware? And the way that we answer is that we don't know. I think that one of the places I can refer you to also is, and I didn't cover this, is there's breast cancer risk for the cancer.org is a nice sheet that talks about risk factors that you can change. Now, we mentioned those with the prevention, the Brenda name, and then the family history is so important for people to understand in the family. Is your risk different than the average risk? Would it be important if a younger person in your family saw a genetic counselor and then your risk changed? So you would need to start screening earlier, or you would need to be tested. So I think these are that's one thing. The other thing that we do know is we really need to be able to study and tumor samples, because the more tumor samples that go into a registry, then they can be utilized for looking at differences or commonalities. And that's where we felt in Delaware we could make a difference to try to do a better job with the tumor registry and the genetics registry and sampling tumor samples. And by all means, I'm not the expert on the environment in Delaware, but I've been around long enough to know that that's what people, we tend to hear that. But there's some personal health changes that you can do, like I said, that will also help you lower your risk of heart disease, diabetes, and obesity. And our obesity rate in the state is not low either. So is there a connection between that? So I know I didn't answer it perhaps the way that's the best I could do.
Yeah, that's good. Yeah. It seems like there's could be other factors. Another question that came in for you, Nurse Nora, is someone is asking. They're saying that I have brothers and cousins who died from cancer. Since I am a female, should I worry although I get my annual checkup?
So that's a great question. And so I go back to kind of the answer is, if you have cousins that are blood, that if you do a family history and you map them out on, and you can pull down any of these family history charts on any website now, you can just say, I want to look at our family history, and they ask you mother, father, and then the children, and then you write next to it what age and what type of cancer, and then that you're beginning to build that pedigree for the genetic counselor to look at. The other thing I should clarify too is breast cancer can be a genetic, that the father side is the one that's showing breast cancer or prostate cancer. So we always have to look at what's going on in the mother's side and also the father's side. Okay, so keep that in mind. Everybody said, oh, we don't need to worry about what the father or the grandparents. No, yes, you really need to look at the whole picture. And the other thing that comes up, I'll just jump off to this one, is if adoption has come up where people really don't know their history. So what's their risk? So sometimes if they are definitely newly diagnosed and they're not sure of their history, they'll go ahead and they'll do some testing because they have to find out like the baseline of where you stand. If you don't know, if you don't know what your family history is, it's always good to just, say, I don't know. I don't know what happened. I don't know my mother's side. I don't know my father's side. So.
Okay, fantastic. Thank you for that informed discussion. I would like to ask Dr. Knight to rejoin us as we engage our listening audience and to share his thoughts and comments before we unmute the line.
Oh, yes. First of all, I would like to say thank you to Nora. What a fantastic presentation, based on the fact that you're used to doing it with slides and you had to do it through a conference call. So that was brilliant. I really appreciate that. I think that what we should do at this point, I know you have a slew of questions, Dr. Darlene, but why don't we go to the floor? Let's
let's do it.
See if we got some questions and so create some dialogue.
Yes.
So you take it over from here, Darlene.
Okay. Questions from the floor for Nurse Nora. I keep calling you Doctor Nora.
It's okay. Either way, I'm privileged to be either way.
Hi, Nurse Nora. This is Yanni. How are you?
Hi.
I love
I'm
the
good, thank you.
presentation, and I appreciate it. And I have to jump off shortly. I have another conference call. But anyway, I have a question regarding men and breast cancer. Okay. I know that the name Brenda, it is girly, but how do you relate that to men? I know the acronym and the work that goes behind the acronym is important, and they could use this same acronym to help. But, for example, men can't breastfeed. Do you have another suggestion or any more information that will help them? Information for men, especially. Yeah.
Men. So I have in front of me, because I knew that was going to be a question, on the American Cancer Society website, there is a wonderful, you can Google breast cancer in men, and it comes up with quite a long list, I want to say 9 or 10 pages. But it will talk to you about the risk factors, prevention, treatment, but it also talks to you about the risk of men with radiation exposure, Klinefelter syndrome, liver disease. So it talks a lot about things that could, testicular conditions that if men have them, it predisposes them to maybe male breast cancer. So I don't have an acronym for that. I think that the important thing is for men to know some of this family history. I know that I was out in the community, I'll say this real quick, and a girl came up to me and said, look, my husband was getting larger breasts, and he's a young man, and I didn't understand what was going on. And I said, did he have any problems with his testicles or anything like that? She said, I don't know, but I have to go ask. So Klinefelter syndrome is a syndrome that men might have, that there might be problems with infertility, and it's hormonal, and they develop a gynecomastia, it's called. So it can be enlarged breast, but maybe not necessarily breast cancer. So just that piece. So you have to develop a little bit different for men, but I think the issues about alcohol and the other healthy lifestyles are the same. Doing all those last things are the same, and knowing if there is a family history or a personal history of the problems with Klinefelters. But the American Cancer Society, Google breast cancer in men. Is that good for you?
That's good. Thank you so much.
Okay, good. Okay.
Okay, the floor is open. Any other questions for Nurse Nora?
Let me just
friends out there.
Go ahead.
Okay, can I just ask a question?
Sure.
Well, if someone else wants to go, they can, but I could hold on to this.
Yes, Hi, my name is Patricia Daniels, and I was wondering, how are you?
Good, thanks.
I was wondering,
LaVon Curry.
how many cases do you have in the age range, like up to 65, with the breast cancer that you discussed tonight?
How many do I have with breast cancer up to age 60?
I'm sorry, what are the statistics of, ladies having that...
having triple negative?
Yes, ma'am.
Or just having breast cancer? You know what? I don't have that in front of me, to be honest with you, so I would be misspeaking about that. But I will, let me see, I just think I had something. Because, I might have old data. This is old, too. I can circle back and send that through with the number. I'm trying to read this real quick. It affects 30% of all women. See, some of our data, too, is very much related to the Graham Center versus national data. So I can find a resource for that because and I actually can get something maybe from Dr. Sims Mortada. She may have pulled something recently. There's a lot going on with clinical trials and things like that related to triple negative. So I just don't have that answer, so I'll do my best to get an answer for you.
All right, well, thank you.
Mm-hmm.
Okay, any more questions for Nurse Nora regarding breast cancer prevention and early detection? Well, Nurse Nora, a question did come over again, another one, and they wanted to know, should they get a second or a third opinion if they do get diagnosed with having breast cancer? And are all the tests created equally?
Oh, well, let me answer two ways. You're always entitled to go to get a second opinion. And our practices that I know physicians and locally, physicians will say, go get an opinion. If this is what the plan is that I believe that I need to offer you based on your situation. But if you would like to go get a second opinion, you can go get a second opinion. You can go get a third opinion. In my experience, some people have gone to do that and got the opinion, came back and got treatment with the first physician or the first treatment team that they went to. And what was the second part of that question? Are all tests equal? Is that what it was?
Yes, are all the tests created equally?
Meaning like the screening tests, like mammogram, ultrasound, MRI? So So we've evolved into different mammography technology. And so some of you have heard tomosynthesis or 3D mammograms, 2D or film. So if you talk to a radiologist, which I'm not, but our radiology team does 3D mammography, tomosynthesis, okay? The reason why is because the pictures, if you think about like your camera and how your phone camera has evolved, the pictures are clearer, they're more distinct, and actually with 3D, they can read your mammogram, not just, they read it in slices, so they actually can see more, find more, smaller areas of concern than when they used to do the standard years ago. So if your facility only offers, say, just standard film, I think a lot of facilities are now into 2D or 3D. You need to ask and just be aware, am I getting 3D or Tomo? Sometimes your insurance doesn't cover. You have to pay the difference. The difference in some areas is $60, $65. Could be more depending on your area of the country. But most are really moving up with having the 3D and the Tomo.
Huh.
Did that answer that? I guess that's I could do.
I think that answered the question. Yeah, they didn't send a follow-up. Thank you so much. Okay, do you have any other questions for Nurse Nora?
Well, can I please ask my question? I finally want to get this one out.
Go ahead, Dr. Mike.
And I think this is important because it's more of a curious question based on your presentation. So women, Nurse Nora, women who have breast implants, are they at a higher risk of breast cancer or triple negative breast cancer?
That's a good question.
That's a great question. So when you have a breast implant in, you always have to tell mammography technologists that you have implants in because the breast tissue has been taken away. And so it's hard to find imaging, to image implants. So, yeah, I worry about women that have implants because you don't necessarily image them because there's no real tissue there. They have the implants. But that's a great question. That's a great question.
Mm-hmm. Yeah. Yeah. All right, Dr. Mike, where are we?
So if nobody has anything else to say or any questions, I'll give you another second to think about it. And I know you're holding back, but if you want to let it out right now, it's the time to do it. Okay, time.
The only thing I want to wait, Dr. Mike, I want to say one thing. During COVID times, we've already seen some articles saying that cancer screenings are going down, and it's because you don't have access. Please, to everybody, if you're off your schedule of your mammogram or any of your other cancer screenings, is put that on your to-do list when your facility or your agency is able to get you back in. Do not delay a year on any of your tests. Get that back as a priority for yourself and your loved ones.
Very good advice.
I have a quick question. I'm sorry, guys. I've come back on again. This is Yoni again. Do you need, I know most of the time insurance covers the mammogram, but do you always need a prescription from your doctor? Can you just call certain centers and get a mammogram without a prescription?
So the answer to that is yes, you need to know what your state requires. Mostly you need a prescription in some facilities so that they know you have a doctor of record who's going to follow up with the screening or the finding. But if you're established in a facility, you could call them and say, do I need a script? If they say, no, you don't need one, you can come in for your annual, you don't need a script. But you have to have a doctor of record that's going to get the report. So you can't give your dentist as the doctor of record. It has to be your primary care.
Thank you.
You're welcome.
So we have reached the top of the hour. We had a full house again. I really appreciate it. So in closing, I would like to offer a few things that you can do to support self and others during this pandemic. First, take breaks from watching, reading, and listening to news stories and social media. Hearing about this pandemic repeatedly can be very upsetting and annoying. Take care of your body, as you heard tonight. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid alcohol and drugs. Make time to unwind. Try to do some other activities you enjoy. Connect with others, because as you know, loneliness is on the rise. We'll discuss that another time. Talk with people you trust. It really is, because of various reasons. So talk with people you trust about your concerns and how you are feeling. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. And lastly, if you or someone you care about are feeling overwhelmed with emotions like sadness, depression, or anxiety, or you feel like you want to harm yourself or others, call 911. I think that's the only way to do that. So I want to thank our guest, Nora. Nora, Nora, you have been having problems pronouncing your last name for late.
I find you know how to find me though. Nora Katurakes.
Okay. Well, thank you to our guest, Nora Katurakes. She's from Christiana Care. Katurakes, that's right. From Christiana Care, Helen F. Graham Cancer Center and Research Institute. He did a fantastic job, and I'm so appreciative. And to my listening audience, thank you, Nora. We're going to do it again. And to my dynamic, brilliant co-host, Darlene Pierre-Louis, I can never say it too much, how much I love each and every one of you. So good night, and I love you all, and I'll see you next week.
We love you too.
You too.
Bye.